Hello, everybody. This is Dr. Marzban from Marzban Family Chiropractic Complete Injury Centers, talking from Carrollton, Texas. And today I'm going to be briefly talking about what could be the cause of the temporomandibular joint dysfunction. And this is the joint right here that I'm interested to talk about briefly. And there are some people that they have issues with this joint, and there's a pain in the jaw area, and it's hard for them to chew or eat food, and therefore they come and visit us and the other doctor office related to that issue. The problem with this joint could be multiple reasons, and it could be one or a combination of a few. And in this picture, you see that we have the temporalis muscle right here. Here's the master muscle right here. We have the lateral pterygoid muscles right here. And those are the major ones that they are dealing with the jaw movements. But there are medial pterygoid muscles as well. We have the buccinator and other muscles that are located in this area, deep or superficial. But the tightness of these muscles right here could also shift this joint because there's one on the other side. This is the left side, there's the one on the right side, and there's going to be a shift of the joint to one or the other side. And over time, it causes inflammation and pain in this joint right here. And the trauma could be an example for that, or because of chewing something hard, um, it can cause the muscle spasm at this area right here. And so it could be multiple reasons for it. And also, the other thing that could cause these muscles to become tight is the dental issues, some infection of the mouth, and some even the eye pain could be causing the tightness of that, or possibly the sinusitis. So the muscles can be tight on one or the other on both sides, and that causes these joint not to function normally and in without pain. But there are other things that could be contributing to the TMJ dysfunction, and that's what I'm trying to get into here. And here is the report that shows that people that have anxiety, depression, and mental stress, they could have the disorder in that joint. And this report right here, it shows that um, I don't want to go in detail of every one of those nuclei and connections, but I just want to overview this and saying that there's an area right here which is called the limbic system, and the limbic system is dealing with emotion and stress and depression, and with the connections to the brainstem as well as the other part of the brain, which we call the cortex, and especially in the front and the parietal area. And the temporal definitely is the major temporal lobe, which is major part of the brain with the limbic system. But regardless of how it is designed, which is very complex and beautifully orchestrated, what I'm trying to show with this picture and what the author was trying to show with this picture is that the limbic system can relate itself to the part of the brainstem, different parts of the brainstem, and including this red circle right here, which is called the trigeminal motor nucleus. What the trigeminal motor nucleus does is that it controls the movements of the muscles of mastications, which include those muscles that we saw in the previous picture. And so, what this showing is that this limbic system, emotion, anxiety, depression, mental stress, it can contribute negatively to the trigeminal motor nucleus, which causes the muscles of the jaw to become tightened, and it can also could cause tightness of the muscles on one side more than the other side, because the right brain and left brain can function separately with the communication, but one has a different function or a stronger function of some type than the other side. So therefore, even though we have TMJ on the right side, TMJ on the left side, muscle mastications on right and left side, but the brain can be contributing a little bit differently because the right side of the brain and left side of the brain, they are not completely the same. And if I go to the other picture that this article was showing, is that, well, it's a little bit more complicated right here. And it shows that if somebody has the limbic system issues and emotion, anxiety, stress, and so forth, so on, as far as the limbic system goes, it can contribute to the hormonal release at the pituitary, but it's a hormonal release, and it's going to be affecting the autonomic nervous system in the brainstem as well as the spinal cord, which that could contribute to make the changes at the this nucleus right here, again trigeminal nucleus, which controls the muscles of mastications. So if the patient comes to the office and has the TMJ issues, it can be muscle, it can be the joint issue, it could be the dental issue, and but also the clinician should be focusing and examining the mental stress that the patient might have, because as we all know, one way or another, either ourselves experienced it or we know someone in the family or friends that have had that experience, is that people, they clench their jaw or teeth and during the night, or it could be during the day, and that is pretty much contributed to the stress level of that individual. So we already know that. So someone has the TMJ issues, clinicians should be thoroughly examine the joint itself, movement of the joint, and the muscles around the joint, dental and mouth issues, and also look into if the patient needs to get help as far as anxiety, depression, mental stress, and the limbic system is concerned. You have a wonderful day, and you take care of yourself. Bye-bye.